Hey good people, welcome back to Community Medicine, a channel where we discuss matters health. Thank you very much for your continued support. Let's keep doing this. So today we shall be looking at what is erectile dysfunction and what are the risk factors and causes of erectile dysfunction. Make sure that you join me until the end. So erectile dysfunction is also commonly referred to as impotence, and this is actually the inability to sustain and maintain an erection firm enough for sexual activity or sexual intercourse to take place. For one to experience an erection, a number of body organs have to work in harmony. For example, the blood vessels, the muscles, the nerves, the brain, and also emotions have to be involved. So we normally have primary erectile dysfunction, and this is whereby an individual has never achieved an erection firm enough for sexual activity to take place. And with secondary impotence, this is an erection in an individual with a past history of satisfactory sexual performance. So what are the risk factors and the causes of erectile dysfunction? One of them is we have various health conditions or medical conditions. For example, type 2 diabetes, we have hypertension, we have cardiovascular or heart diseases which may interfere with the blood vessels supplying the penile tissue. For an erection to happen, the penile tissue needs to be adequately supplied with blood. Other conditions include chronic kidney disease, and if one is overweight or one is obese, they would also be at a risk of experiencing an erectile dysfunction. So other factors include substance abuse. So if one normally consumes alcohol excessively, or they normally smoke excessively, or if they normally abuse other substances like heroin, like cocaine, they are likely to experience an erectile dysfunction. And this is because long-term use of these substances normally damage the blood vessels supplying the penile tissue. And remember, we said that for an erection to take place, the penile tissue needs to be adequately supplied with blood. So if there is an interference with the blood supply to the penile tissue, definitely one will experience an erectile dysfunction. So something else is psychological factors. For example, if one is experiencing depression, stress, if one has low self-esteem, if they are afraid of engaging in sexual intercourse, all these factors would interfere with the mental state of an individual and hence interfere with an erection. Another thing is damage to the nerves. Damage to the nerves would lead to interference with the signals that are traveling from the brain to the penile tissue to enhance an erection to take place. And damage to the nerves would be maybe due to surgery or injury to the spinal cord, or surgery or injury to the pelvic organs, for example, the bladder, the prostate, or other medical conditions, for example, stroke. Another thing is injury or trauma to the penile tissue, for example, a penile fracture. This would definitely lead to an erectile dysfunction. So another thing is sleep disorders, as for example, sleep apnea or insomnia. Sleep disorders may interfere with the mental state of an individual and thus put them at a risk of experiencing an erectile dysfunction. Another thing is hormonal dysfunction, for example, low levels of testosterone, so the primary male sex hormone. So if the testosterone levels are reduced, definitely there would be an issue, or there would be an interference with erection. Last but not least, erectile dysfunction is normally a side effect of various medications, for example, the antihypertensives, the anti-anxiety drugs, the antipsychotics, and even some chemotherapy drugs. So if you're using or if you're under these medications, you may experience an erectile dysfunction. So now that you have the information on what is erectile dysfunction and what are the risk factors and the causes, you'll be more on the lookout, and you'll be able to seek medical assistance in case you feel that you could be experiencing an erectile dysfunction. And make sure that you join me on the next video, because we shall be looking at how to treat how to manage an erectile dysfunction. So make sure that you join me on that video. You can hit on the notification button so that in case the video is out, you will be notified. Thank you very much for your time. Kindly don't forget to subscribe, to like, and to share this video. Thank you, and bye bye.